Hello people, welcome to my channel Physio Guide by Divya. Today I am going to teach about the topic meningitis. Okay, first of all, what is meninges? Meninges means the three layers of the membrane which protects the brain and the spinal cord. Okay, the three membranes, what are they? Means the inner side is pia arachnoid is filled with the fluid and blood vessels. Next one, dura mater is the outer hard tough surface which is located outside. Next is skull. Here skull. Okay, now first of all, what is meningitis? Means inflammation. If there is any inflammation of this meninges, this is known as meningitis. Okay, meningitis refers to inflammation of the protective membrane of the brain and spinal cord. Pyogenic meningitis is a serious condition which may lead to a brain damage and death also, especially in the young children. Okay, so in this meningitis, bacteria may invade, means come inside in the subarachnoid space here, direct by spread from continuous structures, like for example by any sinus, a nose problem, by any sinus or any fractures. In most causes, the infection causing meningitis arise in the nasopharynx here. From here it occurs mostly, or intravascular invasions, any tumor like cells build up in the blood vessels. Next one, penetrate the blood barrier, immune system, which follow mucosal involvement also, and that enters CSF, means cerebrospinal fluid. Okay, this fluid which stay in the arachnoid space. Next we'll see the organism. What are the organism that cause this meningitis? Inflammation means in neonatal, means in newborn, the bacteria is gram negative bacilli. For example, like E. coli, Klebsiella, Haemophilus influenza. In children, the infection that cause a Haemophilus influenza, pneumococcal, meningococcus. Okay, in adults, in adults, the pneumococcus, meningococcus. Okay, other bacteria, listeria, streptococcus example. Okay, now pathology, how it enters the body and how the bacteria develops, means the infection, firstly the infection extends through the subarachnoid space, the middle area, middle membrane. Next becomes congested, oedematous and ischemia, and bacteria multiplies, inflammation is seen, and cytokines and interleukins, those immune system which helps the body, are released. As this inflammatory bacteria enters the body, these cells are released and cranial nerves are compressed. As a result, there will be direct damage. What is the clinical features? Symptoms are seen in the patient, means first one, clinical trial is, first they'll feel fever, headache, neck stiffness is seen. Next one, a respiratory infection and otitis media or pneumonia associated with muscle pain also is seen. Meningitis symptoms are severe frontal and occipital headache, stiff neck, photophobic. Okay, the Kernig sign means this is if the stretching of the lumbar root. If we ask the patient to stretch the lumbar, means we ask the patient to bend downwards, they feel pain. So this is the Kernig sign. Next one, the signs what doctor understand, means will identify, means we'll see high fever is seen in the patient and skin rashes is seen in meningococcal meningitis. Okay, next one, features of causative bacteria is this meningitis is divided into three types. They are Haemophilus meningitis, meningococcal meningitis and pneumococcal meningitis. Next one, investigations. When we should do CT scan, X-ray, lumbar puncture, means CT scan should be done if there is any, if the patient has altered consciousness, if there is no proper consciousness and focal signs and palpedema, the CT scan should be done. Lumbar puncture also need to be done for evaluation of the symptoms. X-ray need to be done. When X-ray need to be done means chest X-ray need to be done in pneumonia. Sinus X-ray, sinus nose, near the nose, sinus X-ray need to be done in sinusitis. Skull X-ray skull x-ray need to be done if there is any fractures. Now we'll go for treatment. Okay, once meningitis is suspected, treatment must be given immediately. Firstly, initial therapy is antibiotics. Above 1 month, the tablets treatment is ampicillin, cephalosporin, amyloglycide. Next, children under 5 years, low dose vancomycin plus third generation cephalosporin vancomycin. Okay, in immunocompromised patients, the tablets need to be given vancomycin, ampicillin, cephalosporin. Next is steroids. 4-day regime of dexamethasone along with antibiotics are to be given. And duration also is given. These tablets need to be given for 1 week. Haemophilus meningococcus are continued at least for 1 week. Next, pneumococcus continue for 10 to 14 days. So these are the treatment should be given. So I hope you understood this topic. Notes also I'll give in the description. So once check it out. Thank you for watching this video.